card plus. Now, in combination with the card plus, why I wanted to show this is because the vectors which are green are normal. The ones that have blue are cellular damage. If they're already red, that's organ damage. So why is it important? Because for people who have cancer, you will see a lot of red lines. Later, I will be showing you an example of that where they cross 3 or even 5 different columns that are all red, and they already involve the endocrine system, which is shown in the triple heater, and they also involve the spleen, which is for the immune system. So when the spleen, the triple heater, and one particular meridian are all red, that is indicative of cancer. And you can even tell the stage of the cancer depending on how long the red line is. Here is a case of a patient who has uterine cancer, stage 4B. And what I wanted to show you is there are a lot of red vectors here, and they cross 3 to 4 columns in the card plus report. It also involves the spleen, which already has a red vector, and here the liver already has the longest vector. So as the disease progressed, you can see in this next chart where the triple heater is also already red, and there are multiple meridians that have red vectors also crossing 4 columns of even 5 columns of the card plus report. This is already metastasis in multiple organs, and this was taken a few weeks before the patient died. And when you look at her card, it also shows that on the right side, it's predominantly on the hypoactive end, and on the other side, it's predominantly hyperactive. Also in the spine, this person has been lying down on one side only because of the pain, and you can see that the right side of the spine are all red and inflamed, and the vertebrae on this side are more far apart, and here you can see a lot of blockages on the left side. So this is just to show you one example of how it looks like. As with the card, you can also use the start button here on Card Plus to see which vector becomes red first, or how the meridians behave as a whole without looking at which one is for the left side or the right side. So here you see that the kidney meridian, the vectors become long and have become red. This is where you can already see organ damage. If it's blue, it's just cellular damage. If it's not moving so fast, that means the changes are also not fast. To help you more in understanding the Card and Card Plus report, it's important to be familiar with the Horary cycle. The Horary cycle is used in traditional Chinese medicine to know which meridians are active every 2 hours within a 24-hour period. So this is an example on your screen. And with each activation of a meridian, there are particular activities that need to be done on a daily basis to be able to be in harmony. So you can see on the table here below the Horary chart are the time or the schedule for which particular activities need to be done. So once you are familiar with this, you can properly interpret an ARDK report. So the red part that you see here in the card, for example, in this particular report, it's the bladder. This red indicates that it is active. And the blue one here, which is lung, which shows that it is inactive or sleeping. So once you know that which one is active and which one is inactive, you can now associate it with the current energy that flows through a meridian. So example, bladder should be active. So this meridian with the number 7 should be here in hyper region, either in the middle right or in the extreme right portion. When you see that it's there, sometimes it's not pathologic. It's just because that it is active that you see it there. However, in this particular report, you can see that it is in the extreme hypo region. Although it should be active, then you know something is wrong because the activity of the meridian is opposite to what it should be. Next, let's check here with the lung meridian. The lung meridian is supposed to be hypoactive at this time. We see the current energy to be here in the middle. That's okay. That's fine. But if you see it also hypo, and you see that this one is blue, sometimes it's also not pathologic because you know that it's the resting time of that meridian. However, if it's on the opposite side, then you know it is pathologic.